Hey guys, Woodruff here. So I've decided to start to try to hop back into a little bit of teaching and making videos more often. So I'm easing my way in. So most of these videos are going to be more short, sweet, simple, to the point, but hopefully they'll be helpful somewhere on your journey. So this is a kind of a next generation, kind of little mini case study, kind of practice question about dehydration. Let's see if I can move forward. Oh, and along that line, so I'm trying to get back into teaching a little bit. So if you're interested, a lot of people have reached out to me in the past looking for tutoring. Here's like I made a simple like bit.ly link if you want to find me on there if you're interested in tutoring. And this can be for general test taking strategies, any general topics like med surge, critical care, foundations, pharm, patho, general studying strategies, preparing for NCLEX, mentoring, the general stuff. I can help with pretty much anything except for OBP, psych. It's just not my forte, and I don't have a lot of background in that. I can try to help you, general tips, but I'm not well versed in those topics. So if you're interested in tutoring, there's that. And I just found out, I guess, that YouTube, it's been bugging me for a while about doing this membership thing. It's just for people that are interested that either want to support the channel or, want some more of the benefits of like being a member. So some of the things like that you can like do a poll. I can do polls to see what videos you guys want to see next, and you can have an opinion on that. Start doing like member only like live chats or live streams, things like that, where we can like kind of more one-on-one work. I can answer questions and kind of help. So yes, those are some of the benefits. So if any of that sounds good, feel free to utilize that. All right, so let's get into the case study. So for this patient, the case study is there's a 45-year-old patient. They're admitted with severe vomiting and diarrhea for 3 days. The nurse notes that they have dry mucous membranes, poor skin turgor, and their blood pressure is 90 over 56. Their heart rate is 112, and they're feeling dizziness when they're standing. IV normal saline order is placed for 125 mils per hour. So let's look at our first question. So it says, which findings support the nurse's concern for fluid volume deficit? And this is a select all that apply, which I know is everyone's favorite. So, what I like to do is select all that applies is first, I like to read all the answers because automatically I'm like, okay, it has to be at least two, it can't be five. Like all these rules are going in my head. So I always like to start and just kind of read through. So I have my options are my blood pressure. Does that show fluid volume deficit? My heart rate, the fact that I have IV fluid order at 125, the fact that they have dizziness when standing, and moist mucous membranes. So sometimes what I like to do, it puts some strain and pressure off of me, is I like to look at this and say, okay, what is ones that I can automatically be like, nope, it is not this. So one that stands out to me is the moist mucous membranes, because I know for me that if someone fluid volume deficit means dry. So I have a deficit, I am low on fluids, I am dry. If I have moist mucous membranes, that's not consistent. So I can already cross those out. So now I'm down to four. So then I can look if there's any others I can cross out. The fact that they have IV fluids going or ordered at 125, to me, that doesn't really have anything to do with fluid volume deficit. A lot of people are on fluids and they're not necessarily in a deficit. I don't think that alone can say whether they are in fluid volume deficit. So then I'm going to look at my others. So now I have A, B, and D left. So A, the blood pressure being low. Does a low blood pressure signify that I have low volume? To me, the answer yes. I'm not saying that every time someone has a low blood pressure, it's because of fluid volume. But this patient, based on their picture, the fact that they have blood pressure of 90 over 56, have been vomiting and having diarrhea for days, to me does show or support, it should say, so that's how the question is worded, it supports that the patient is in a fluid volume deficit. The next is a heart rate, because pretty much like what you can do when you're looking at this is answer the question is, does this information correlate with low fluid volume? Um, and so then we go to so does a patient with low blood pressure most likely, based on this story, have what do you call it, low blood pressure because of fluid volume deficit? So then heart rate. So their heart rate's elevated. So then I have to kind of connect. Okay, what does a high heart rate mean? Well, if you watch any of my other videos on heart rate, one of my cardiac videos, I love talking about the heart. that the heart it beats faster often to compensate or for a few things. It can get higher because of a high temperature. It can get higher because you're stressed or anxious. It can get higher because of heart conditions. But now I need to go back. And again, I need to go back to this story. So based on this story, can I say like, oh, because this is here, like this information is here, does this connect or support, or is it aligned with the story that this person is in fluid volume deficit? So heart rate being high, when you have less fluid in your heart tries to compensate and says, hey, I need more fluid. So I'm going to pump faster to get more fluid going throughout my body. Like it thinks that if it beats faster, that it's going to help with that volume issue. So, low blood pressure and high heart rate are both very consistent. These actually, low blood pressure, high heart rate is one almost like the like whatever you call like the pristine or the idealistic or most common what's the textbook, that's the word I was looking for. It's the textbook description of what you're going to see for someone who's in a fluid volume deficit. So low blood pressure, high heart rate. I'm not saying always, but often that's a sign of fluid volume deficit. So then the next thing is dizziness when standing. And so when I look at dizziness when standing, I have to consider that it's not like, so this is not like, it's about changing position. So if you remember learning about orthostatic vitals or orthostatic hypotension, this is what this is talking about. Is it likely, based on this story, that this person's dizziness when standing is a result of their fluid volume deficit? And the answer is yes. Because of their fluid loss, they have less volume. So when they stand up, fluid shifts. But because they don't have enough fluid, that's where they get that dizziness because the lack of fluid is it's not allowing them to get flow to their brain. So that's what kind of leads to that dizziness or that disequilibrium. Is they're not able to balance their fluids appropriately because they're low on fluids. And we actually see this happen. There's some patients that get the orthostatic hypotension. They're trying to work with physical therapy after having an injury or something, and they start to get the orthostasis. And what we have to do is give them a lot of fluids and get their fluids balanced. And once their fluids are balanced, their symptoms get better. So the best answers here the blood pressure, the heart rate, and the dizziness. Now, I know some people are going to argue and say, well, for this patient, isn't the IV fluids at 125 a good sign of support that they're in a fluid volume deficit? And yes, giving fluids does kind of show that this person probably needs fluids, but they're really talking about what you're looking at in your physical assessment. And so since like this, you can kind of almost cross it out because it's not actually a part of your physical assessment. So, what a question like this is really looking for physical symptoms that the patient's having that indicate their body is telling you that they're in fluid volume deficit. So that's why the best answers for this would be A, B, and D, which are our physiological characteristics that point towards fluid volume deficit. And I bet you didn't think I could talk that long about one question. Here we go. Got two more. All right, so the next question is, which of the following is the most likely cause of the patient's current condition? So you also see questions like this, and most likely means like we can't rule the other ones out completely, but which one makes most sense with their story? So remember, this patient had been nauseous, vomiting, diarrhea for 3 days. Showing signs of fluid volume deficit. So which of these makes most sense? So again, I like to read all the answers down and then go back because a lot of times a mistake students can make when they answer questions is that they see one and they're like, oh, my teacher said this a lot. This has to be the right answer. But you always want to make sure you look at all your options because sometimes or I should say often being a former professor and knowing sometimes we would choose like not the answer we talked about 50 times in class, but like one we talked about once or twice, but you still need to know that it's important. Anyway, so we have heart failure, uncontrolled diabetes, acute gastroenteritis, or renal failure. So we have a lot of different, chronic or acute conditions here. So first, let's look at any ones that we can cross off. So for heart failure is where your heart's not pumping blood forward the way it's supposed to. It's a heart squeeze problem. And so with this, blood's not moving forward, so it's backing up. So this is actually Even though they can have like lower blood pressure eventually and low cardiac output, it's actually a fluid volume overload issue. So I'm going to already kind of put this one on the back burner because it's unlikely that heart failure is the correct answer because of the fact that it's like the opposite of what's happening in this story. So it's not a deficit as much as it is, even though they can't have low blood pressure, it's not a deficit, it's a problem where they actually have too much fluids. And usually they're going to have other symptoms like wet lung sounds, swollen legs, things like that as well. So uncontrolled diabetes. Well, with uncontrolled diabetes, usually they're voiding a lot. Like sometimes they have so much sugar that they're peeing out all their fluids, so they can be dehydrated from peeing out all those fluids. Um, what do you call it? They could possibly, they can sometimes have some nausea, some GI symptoms, usually not diarrhea. So, like, there's some stuff with the diabetes, so I can't rule diabetes out, but I will say there's nothing in the story that points to diabetes specifically. There's nothing about a blood sugar, there's nothing about polyuria or that they're peeing a lot. So even though my mind loves diabetes and wants to say, look, ooh, diabetes, like just the picture isn't completely clear. So then we have acute gastroenteritis. So this sounds a little bit more like consistent because there's nausea, vomiting, diarrhea, like so it's a GI issue. This one's the closest, but I need to look through all my answers because sometimes this is the thing that students do too, is they get to this answer and then they're like, this is the answer, the only, the end finale. But let's keep going just to be safe to see what else is out there, if there's anything else that might fit it better. Then we have renal failure. So this is a lot like heart failure in that it's not a fluid deficit problem. They do stop peeing because they're not they either have an obstruction, they're not getting enough blood flow to their kidneys, there's a problem within the kidney, like an infection or something else that's leading it to fail. So the urine's not getting out. So if urine's not getting out, all that fluid is building up in the bottom body. So again, even if they have a low blood pressure, it's not enough fluid problem. It's a too much fluid, not in the right place problem, or not leaving the body, just like heart failure problem, too much fluid not moving forward in the heart. Renal failure is the fluid kind of getting stuck in the body versus getting excreted through the kidneys. So A and D, I think, are both, down for the count because it's a fluid overload issue versus an underload or a deficit issue. So then I'm left with B and C. And then out of both of these, I have to go back to my story. Which one of these is most consistent with my story? I'm gonna have to go with C, which is the correct answer, because it's the only one that matches my story perfectly. Now, again, if I really like thought and analyzed for 20 minutes, and ran out of time on my test, could I choose answer B? Absolutely. But it doesn't have the information provided is not as consistent with B as it is with C. So it's almost 100, it's like pretty much 100% consistent with answer C because gastroenteritis, it's like a stomach bug. It's where you have nausea, vomiting, diarrhea. You're either sitting on the toilet, vomiting while you're simultaneously pooping. It's a virus, a bug. It lasts usually for a few days and gets better. But in those few days, like you can't keep anything down. You lose a lot of fluids. Your electrolytes can get unbalanced. It can lead to those issues. So the best answer here is answer C. All right, last but not least, the patient has another episode of vomiting after starting IV fluids. What is the nurse's next priority action? So the patients come in, we've kind of assessed some things, we've started their IV fluids. Now what do I need to do? And this is what we call a drag and drop. So these are really popular, and often the drag and drop will even have more options than this. First, again, I read everything. So drag and drop, my options are reassess blood pressure and administer an antiemetic, monitor urine output, and encourage oral fluids as tolerated. It's not asking me if these orders are appropriate. It's just saying these are all ordered. Which order are you going to go in for these? How are you going to use your nursing judgment? So with one like this, what helps my brain, and this might not work for you, but this is what helps me with these kind of questions, is first I try to see, just try to group them into, does this seem really important, or is there any that seem super important, or any that seem not as important, I could put them on lower on my list. So for me, Like they vomited, so like the antiemetic seems kind of important. Blood pressure is really important. Um, Monitoring urine output, yes, because that kind of lets me see is what I'm doing effective. So that's kind of important too. Encouraging oral fluids is tolerated. They're on IV fluids. They're getting something. They might not, they're vomiting still. They might not be able to do oral fluids for a while. So I'm kind of putting oral fluids on the back burner. Out of all of these, it seems like it is going to be the last thing. So that still leaves me with three, what I see as important things. So one, two, and three seem important to me, but what seems like the most important? And so sometimes, not necessarily in this situation, but in sometimes you're going to have a situation where it's like, I have to ask myself, which of these, if I don't do it right now, the patient has the best chance of dying if I don't do this. But for a question like for this particular scenario, I should say, it's more about what's going to provide like the most relief or help for the patient, or what does the patient need the most right now? They already have IV fluids going, yay, so we're rehydrating them because that's their main problem. What just happened? They vomited. So the first thing, in my opinion, of what needs to happen, in my opinion, and as the one who wrote this question, so yes, sorry, sorry, it's my autism in my head. But yes, I'm having a whole conversation in my head laughing at myself. If you're autistic, you understand. So anyway, so the first thing that makes most sense is to administer an antiemetic because they're actively vomiting. So to do any of these things, if they're actively vomiting, and then I'm like, here, let me check your urine output, or here, let me check your blood pressure, sure. Need to do it, but I need to get them something to get them relief. Because here's the thing, if they're still vomiting, they're still losing more volume. So I need to stop, like pretty much it's like stopping the bleed. If someone's bleeding, we can give them blood, we can check their blood pressure, but if they're still bleeding until we stop the bleeding. So this is the same thing. Until we stop the vomiting, we can't really help them move forward. So we're going to administer an antiemetic. Then what do I do first? Do I reassess their blood pressure or monitor their urine output? Both of these help to kind of reassess with where I'm at, but which is more important? Yes, organ, like a really good measure of how I'm doing. Blood pressure is helpful, but like seeing how my like ends, like organs are like doing with it. Like in other words, like I can have an okay blood pressure, but if I'm not making urine, it's a pretty good sign that my stuff's not effective. But in this case, they had a borderline. I didn't calculate the map for that blood pressure, but it was either just barely okay or maybe just above okay, like, if it was okay. So what I would want to do, based on like life or death, thinking ABCs and what interventions are going to help give me the information that I need to take next actions. What I need to do is first administer an antiemetic. Oh, weird. My video was kind of freezing for a second. I was like, oh, I'm a robot in slow motion. Sorry. Oh, I'm getting distracted again. Oh, this is horrible. Anyway, administer an antiemetic. Second, I need to check their blood pressure. And the reason I'm checking reassess blood pressure, they just vomited again. Their blood pressure was already low. I started IV fluids. Their blood pressure is still low. They may need a bolus of fluids. I may need to contact the doctor. So, in other words, if their urine output is low, I'm going to need to contact the doctor too, but it's more life or death urgent or something I need to do right now if their blood pressure is low versus their urine output. So, antiemetic, blood pressure, monitor their urine output, because reassess is more of like I need to see if what I'm doing is working, whereas monitoring the urine output something kind of more maintenance or routine, the way that it's worded. So antiemetic, blood pressure, urine output, and then if they start doing better, then I can start encouraging oral fluids as tolerated. And once they're doing enough oral fluids, then we can get them off the IV fluids. Other treatments for these, most of them is just supportive care, trying to like slowly encourage them to start eating and drinking, replacing electrolytes. So like another option could be here to draw labs or, assess what their labs are. Um, and so definitely like the things you want to look for there too is if it is assessing like labs and stuff like that, is has there been any sign of instability? Like if you would look for things in the question like patients reporting palpitations, patients having PVCs on their monitor, if they're doing that, then checking the electrolytes going to be a lot higher on my list. You poop potassium. So like if I'm pooping a whole lot or having diarrhea, I'm losing a lot of potassium. So that's one of the main ones I worry about, but we also worry about our magnesium and things like that. So anyway, I think that's the major things I wanted to talk about. I want to see if there's anything else I want to say about gastroenteritis. It's mostly just replace fluids, oral when tolerated, kind of slowly incorporating food more, checking fluid and electrolyte status. That's the major things. And then again, seeing, making sure it's not affecting their blood pressure. Anyway, I'm just making sure I wasn't forgetting anything. But this was my quick, remember how I said this was going to be a quick video and 20 minutes later I'm done. So, but this is maybe quick for me, someone who starts teaching and is like, I'm gonna just tell them something real quick. And then here I am, 20 minutes, 38 seconds later, still chatting. Anyway, yeah, thanks for being here. Hope this helped. I'll see you guys again soon.